Hi, in this presentation I'm going to share with you the telemedicine for stroke project that I have coordinated in Brazil some years ago. As we all know, stroke is one of the main causes of death in the world and of course in Brazil and Latin America as well. And it is considered the main cause of permanent disability with a high social and economic impact. This is a publication that some colleagues from Latin America and I published in 2007 in Lancet Neurology, where we presented the stroke epidemiology, the prevention and management strategies at a regional level in Latin America and Caribbean. And you can see in the right figure that shows the mortality rates of stroke in different Latin American countries. We have Brazil as the fourth main country in terms of death in stroke. So it's a huge burden. And this burden is reflected in this other publication when I was collaborator of the Global Burden of Disease, GBD, that was coordinated by Washington University. So among the 10 top causes of years of lost life in 2013, stroke was the third cause, not only for Latin America but also for Brazil. So these are some evidence of its burden. In another project that was conducted by the Brazilian Federal Medical Council together with other institutions, we can see here the number of neurologists per state and region in Brazil. And it's clear that in the North region, Northeast region and Center-West region, the number of neurologists is scarce. So from these more than 4,300 neurologists, most of them are located in the Southeast and South region of Brazil. The strokologists, as so-called, the neurologists that work in stroke, where are they? So, of course, they are fewer than this number. And if you consider the numbers of hospitals in Brazil that are more than 6,700, you see that there is a need for more access of qualified stroke neurologists to take care of these patients in Brazil. So we have a problem here, and not only this, but also several public hospitals, and many public hospitals, but some private as well, as full of patients with different diseases, and among them are stroke patients. So how to help, how to improve the care of these patients and to improve their outcomes. So this is the way that we can help confirm the effectiveness of telestroke. So one of the strategies that can be used to help treat patients with strokes, mainly in the acute phase, is telestroke. So it is one of the solutions that we can provide to urgent departments or emergency rooms to properly treat stroke patients in its acute phase. So in the year of 2012, I participated together with other two neurologists, two colleagues, in technical consultation for the Brazilian Minister of Health. And what we achieved was an ordinance with care pathways for people with stroke. Consider stroke units, thrombolysis, and telestroke. So the ordinance were published in April of 12. And in these three of decisions, we can see here that telestroke is included as one option for the care of acute patients. So we developed this project in the German hospital Oswaldo Cruz in São Paulo within the ProAD-SUS. It is the telemedicine for stroke project. In 1 minute I'm going to present what is the ProAD-SUS. So we built this project to support public hospitals for the care of patients with acute stroke, considering the first 72 hours, through trained and specialized teleconsultations via telemedicine, 24 hours a day, 7 days a week, from the telemedicine center at the Hospital Alemão da Cruz in São Paulo, Brazil. So we can see here we were the hub, and several other hospitals or the spokes were the remote hospitals. The ProjeSUS is a program to support the institutional development of the unified health system of Brazil, SUS, which is our public system. And it comes from a law that was published in November 2009, where through the resources arising from our tax waiver, we can transfer our expertise in areas of great interest and social impact to society in projects built jointly with the Ministry of Health. So 100% of this tax waiver are applied in projects together with the Ministry of Health for the public health system in Brazil. But before starting this project, I went to visit some places where the experience in telestroke was really outstanding. One of them was the TEMIS Telemedic Project for Integrative Stroke Care, TEMPIS, that was held in Bavaria, in Germany. It was a center for telestroke in the Klinikum Allerring, which is a municipal hospital in München. So in this picture you can see myself with Peter Miljebarna, who was the coordinator at that time of the Tempest project. This project was built up by Professor Heinrich Odebert that moved to Berlin. I'm gonna also show something that went to Berlin to talk with him and see what they are doing, what they were doing. So here you can see in Bavaria, is the south region of Germany, in Munich, this project with that cover large area of Bavaria. So going to Berlin, I met Professor Heinrich, who kindly asked me to visit their stroke project, and their stroke project, their stroke project also included the STIMU project. That was the first project with an ambulance that was dedicated to diagnose and treat patients with stroke at their place, in front of their house, let's say. So in this ambulance there was a CT scanner, a head CT scanner, and a lab point of care to get the information necessary to take the decision for thrombolizing or not, and then directing the patient to a stroke unit that had a bed available for these patients in a network of hospitals in Berlin. And after that visit, I went to England, to East England, specifically to Cambridge, where the central management of the East of England telestroke network that involves different regions of the East region of England. So it was important to learn the day-by-day activity, the challenges, how to deal with daily problems. That is different from what we just read the article. It is a scientific article, but to see what's going on in the daily practice is very important to build one project. So this is our team, our stroke team. We are composed by 9 neurologists and 2 nurses. All of them are trained in stroke patients with evidence that they have experience in that. I was the coordinator of this project, and so we built up this telemedicine center. And for this telestroke project, we have several steps, and that we can see here, starting from the literature of telestroke, the visit of the services of reference telestroke centers, and then strategies, training of the stroke team, development of clinical protocols and clinical guidelines, implementation in each hospitals, monitoring the teleconsultation, its quality, the indicators and goals for clinical care and outcomes were also monitored, the continuous communication with remote hospitals, and of course the exchange of experience. So these were the main steps of that we have done during this period of implementation of this project. So this is our telemedicine center. We were the first hospital to hire neurologists for telestroke, 24/7 presence in the telemedicine center, where you could have screen that we could see the patient in the local hospital, in the remote hospital, with a camera that we can with PTZ, with a zoom that we can see even his or her pupils. Another screen where you get the information from imaging, like CT scan, and also another one that we have the electronic patient record specifically for stroke. And we also, this is the electronic record screen of the electronic records, where the neurologist would input all the data. We had some automatization, such as the NIH scale. We just could insert the results of each evaluation, and it calculated the results, and also the doses of thrombolysis of the thrombolytic agent according to the patient weight. And we also developed this e-learning platform for telestroke for all the professionals that were taking care of patients, not only explaining how to use telemedicine, but also important aspects of diagnosis, of treatment, and of care of stroke patients to avoid things such as pressure ulcers, bladder infection, and urinary infection, and so on. So we went to each hospital to train all the people that were involved in the project, taking care of the patients, maybe even the administrative people, and people that were just taking care in the emergency room and also in the ward, so they can keep going using the protocols that we developed and trained the physicians and neurologists. You can see here the image of one of our colleagues, one of our neurologists, doing a teleconsultation. We see the patient, and the emergency physician examine the patient. This lady has acute onset of hemiparesis and dysarthria. You can see in the bottom right, in the monitor, you can see the neurologist, the nurse that were following up, and this patient had the indication of thrombolysis. She had the criteria to be thrombolyzed. It was done there. This is the acute stroke room in one of the hospitals, the same hospital that we saw in the previous slides, and they were so involved in the project that they, in this room that was annexed to the main emergency room, where they just have a place for keeping all the material necessary, they change it and built this room where you can have the cards, the telestroke cards, with the camera, with the monitor, with the audio communication that could be also by Bluetooth, and the battery in case there was light interruption, the treatment could go on. And so this was a very interesting experience. And these are the hospitals that we were providing telestroke support. Is the General Hospital of Cruz in the center. So we were doing this for the urgent hospitals of Goiânia, the main public system emergency hospital. The same thing for Recife in the northeast. Goiânia is in the center-west. Recife in the northeast. This is also the main public hospital for emergencies. We also did in the Hospital Pimentas Bom Sucesso in Guarulhos, which is near São Paulo city, and also in Bahia, in Santo Antônio de Jesus. It's a regional hospital that receive a lot of patients referred from the region. So we had two hospitals from the northeast, one hospital from the center-west, and a hospital for the countryside of São Paulo, and then 4 hospitals in the city of São Paulo. There are public hospitals where they have emergency departments as well. And finally, to show the results of our work, these are results from August 2012 to June 2015, and we did what we call situation analysis before starting the Telestroke program in each hospital, so you could see and understand what were the variables that we are studying, what was happening. So before the Telestroke project, thrombolysis was used just 1.3% of the eligible patients, and after we start, we increased that for 7.4. The intra-hospital mortality, this is very interesting to see, because you knew that these benefits will come from the literature, but the intensity of this benefit was really striking for us. From the 26% intra-hospital mortality rate before the Telestroke project, we could decrease it for 2.3. So this was a tremendous work of our team, of the teams of the local hospitals, of our nurses that was in contact with each coordinator nurse, because each hospital has a physician coordinator, not a neurologist, and a nurse coordinator. So both of them were also responsible for implementing the protocols and with our support. And you can see that the hospital length of stay was decreasing from 10.8 to 5.9, and all this, not only the intra-hospital mortality, but the length of stay were reduced, also because the patient was taking better care. So we can see here the decrease of pneumonia. This is the pre-stroke Telestroke project, and this is the post. The venous thrombosis, and then the pressure ulcers. So there was a decrease. So these are the results that I wanted to present to you, the experience that we have to share with you, and we're not able to follow with this project because in the Project SUS, the Minister of Health decided that the financial resources that we're applying in this project should be directed to other urgent matters of the public system. Of course, we are very sorry for that, but anyway, things show that it's not only feasible, but the result of a Telestroke project is immense. Of course, from that time up to now, several other activities were built up. There are lots of stroke units around the public system in Brazil, more than 60 stroke units, and there are some specific Telestroke projects that were developed, but we were the pioneers in this approach. So thank you very much for your attention, and I hope that this was something that you enjoyed.